This is an HRCT of a 63 years old male patient who presented with weight loss and mild productive cough. There is no history of fever. You can see the tiny nodular shadows infiltrating both the lungs. These are relatively more abundant in left upper lobe. Low down, both the lungs are almost evenly involved. These are typical of the miliary carcinosis. Now, please observe that these are also oriented along the pleural surfaces and at places along the bronchovascular bundles. Now, this is an area of increased attenuation. This one here, this has involved the lower parts of anterior segment and apico-posterior segment of left upper lobe, superior lingular segment of left upper lobe, and upper part of the inferior lingular segment of left upper lobe. I wish a contrast NAN CT scan was carried out in this particular patient. In fact, in the private practice setup, you have to do whatsoever is advised by the clinician, and most of the times clinicians do not know what are the indications of HRCT or a contrast NAN CT and what benefits they can get out of the contrast NAN CT. Similarly, in this patient, only HRCT was advised and so it was carried out. Now this is the mediastinal window. This is the irregular area of increased attenuation. This is reaching up to the left hilum. It has surrounded and narrowed the left upper lobe, main and segmental bronchi. This is the lower lobe bronchus. This most probably represents the malignant growth involving left upper lobe. No significant mediastinal lymphadenopathy. So in such cases where contrast NAN CT is not carried out, we must always look around for any other secondary evidence of the growth to exclude pulmonary tuberculosis. For example, liver. We must thoroughly see the liver for any metastatic lesions or any sportive evidence. Similarly, we must see the bones. Here you find sclerotic lesions or osteoblastic lesions involving almost all of the vertebrae. These are suggestive of the metastatic lesions. It is very rare to have sclerotic or metastatic lesions, bone lesions, in cases of carcinoma of lung, but adenocarcinomas, they are known to have the sclerotic metastatic lesions. Please observe the metastatic sclerotic lesions involving almost all of the vertebrae. So it's a case of adenocarcinoma with miliary carcinosis and sclerotic metastasis to the vertebrae.